Welcome to the Oral Health Podcast. So today, because our focus this week for National Smile Month has been money saving and different ways that you can look after your mouth whilst also keeping the costs down, a big part of that is actually prevention and prevention of disease, which is something that our past president, Dr. Ben Atkins, is very, very passionate about. So I asked him to join me today and have a little chat about why the way that we take care of our mouth has such an impact on the health of it, and how a good oral health routine can set you up for success and money saving long term. Thank you, Ben, for joining me, and I hope you enjoy the conversation. Okay, so Ben, I'm sure everyone that's listening to this will be well aware of who you are, but in case they're not, do you want to just give a little introduction about yourself?
My name is Ben Atkins, and I was the past president of the Oral Health Foundation. I've been a trustee, getting on 10 years now for the foundation. So my sort of passion in dentistry is behavioural change. I worked in the NHS for the best part of 20 years. The area of interest for me is the homeless and the hard to reach groups. They're not really hard to reach, we know exactly where they are. They just find it hard to access services. So my biggest pressure is looking at how we can evolve the population to enable dentists to be able to work with them easier. So It's removal barriers, behavioural change. It's really, really interesting. It absolutely fascinates me.
Yeah, absolutely. And that's a big part of what Smile Month is about, is making sure that people everywhere have access to good oral health and that opportunity to have good oral health. And so this week we're looking at different ways that you can keep your costs down while looking after your oral health, because one of the big things that comes up is that dental health is really expensive, because dental visits can run quite high in cost sometimes. But I want to talk to you a little bit about different ways that people can keep their costs down. One of the things that I wanted to ask you about is, when people go and see the dentist regularly, is that then a way that they can make sure that overall their costs are lower?
By visiting your dentist regularly, you can get things caught when they're very small and very easy to treat. So the cost for the treatment is less. Leave things till they are big problems and the expense increases dramatically. So realistically, a checkup is probably the cheapest thing we do in dentistry, and probably it is the most important, because we catch things when they're small. It means we don't have to drill the teeth. We can heal decay, very early decay. Decay takes a long time to present. So it can take over 3 years to actually cause the hole in the tooth, to cause the filling. So we catch it early. We catch any little white spots. We catch any areas of bleeding in the gums. So the patient can then heal those areas with better oral health. So yeah, it's a really, really good point, Sophie, that by going to the dentist regularly, you can long-term stop having holes drilled in your teeth and just do the preventative part, really.
Yeah, the preventative side of dentistry is, I know, something that you're really passionate about, as well as us at the Oral Health Foundation feel really strongly that is the best course. Prevention is the best treatment, for lack of a better term. That sounds really cheesy, but yeah.
I think it's one of those things that I often say to my patients. It's by visiting your dentist regularly, you're paying for the prevention. The other option is leave it for a while and you then pay me to fill your teeth. You've got a choice. It can come across as a bit sort of flippant, but it's very simple. Decay is simply preventable.
One of the things that I've learned in my time here is just how important the regular upkeep of your mouth is in terms of preventing all of these potential problems. So what would a perfect oral health routine look like?
It's a really good question, what a perfect oral health journey would look like, because it makes a basis and it's a habit forming journey. We start with our children and they will come into the bathroom. My children, they came into the bathroom from a very age, from a baby, and just had that routine of brushing your teeth. So the critical time to brush your teeth is before you go to bed, and really spending that 2 minutes brushing your teeth. Often people think, I've got to do it straight away as I get up, but it's about time and about doing it efficiently for 2 minutes, twice a day. So the key one is before you go to bed, because that's when you've got all the detritus from the day in your teeth, what you've eaten, and your salivary drops at night. But if you can find another time where you've actually got 2 minutes to do it properly, because we all know, I've had it this morning with rushing out of the door to get my children to school. there's chaos in our house in the morning. So that peace of mind for 2 minutes, you might want to kick it down the road to 10 o'clock. When you've got a little bit longer time, you think, oh, do you know what? Using it as just a 2 minutes in the day to calm down. It's almost like a mindfulness thing, concentrating on doing it properly. So that's really important, doing it twice a day, brushing your teeth twice a day, but making sure it's under controlled and it's the time of day that you can do it. The really important one is the one before you go to bed, when your salivate, as I say, is going to drop, and your natural preventative journey does slow down at night, because we all know we sometimes wake up in the morning and you've got quite a dry mouth.
Mm-hmm. Absolutely. And what about then flossing and cleaning in between your teeth? Is there a better time of the day to do that?
We recommend that you do clean between your teeth once a day. So personally, I do it twice a day because it's a habit. I use little brushes that go between my teeth rather than floss, because I find that easier. And that's really when you go to your hygienist, or you go to your therapist, or you go to your dentist, say, which is the best one for me? Not necessarily floss. Some areas I need to use floss. So that's the best method for me. But I also recognize that it can be fiddly. There's been some really good stories over the years about floss not being effective and things, but actually floss is very effective if used correctly. It's quite tricky to use. So there's some amazing interdental brushes, there's some air cleaners that go between your teeth that make the process really, really good. About 40% of the tooth surfaces between teeth, and the majority of dental decay starts on those surfaces, so we're not cleaning them properly. The areas between your teeth, if you start getting those really clean, when you wake up in the morning, your mouth often feels really fresh still. So there's a real evidence. I know when I've skipped a interdental brushing at night or in the morning, I feel that my plaque can start to build up. I would often tell my patients, do it at night when you've got more time. Some people have more time in the day, so it's patient dependent on their habits, their times. We're all different. For me, it's that 2 minutes before I go to bed. So I'll use my interdental brushes, I'll use my floss, I'll use my air cleaner. It depends what I'm doing. But that speak to because as we get older, our teeth change shape. So that our brushing techniques need to slightly change. The techniques that's used when you were a 6-year-old child do not work when you're a 78-year-old, in my case, man. So it's really important to have that connection with your oral health team to say, actually, am I getting everything? So often it's between your teeth that you struggle with.
Mm-hmm. So cleaning twice a day, cleaning between your teeth once a day. Obviously, there's things like chewing gum and things that you can use throughout the day to help keep your mouth fresh and help with saliva. And we've talked about that in detail. If you want to go and listen to the last podcast, you can do. I'll link it below. So if you keep on top of your oral health routine and you do all these things, are you then less likely to need the more expensive treatment down the line?
Without question. It's dental decay is fully preventable. So if you brush your teeth twice a day, visit the dentist regularly, brush between your teeth, and really drop the amount of sugar you have in your teeth, you less than likely have having no more fillings in your life.
Mm-hmm.
And as we say, dental disease is fully preventable if you have the correct habit and the correct journey. And we've been through that multiple times, Sophie, about the different techniques you can do, the different areas you can brush. There's some lovely if you want to check your teeth, there's some lovely disclosing tablets you can use that you just chew on. And people go, oh, we can see you as an adult. Of course you can. They're so cheap, but it means that you become the expert in your mouth, because we're responsible. Let's face it, the patient's the one that's going to have the holes drilled in their teeth. If they can see where they're missing every time, because it's a habitual thing. You'll often starting different areas every time you brush is really important as well, because what you'll find is you'll start one area and you'll get tired by the end of 2 minutes and you'll miss the last bit. So if you start at different times, it does have a knock-on effect. There are certain things that, if trauma and things, we can't avoid that. But for me, that preventative journey is the most cost-effective way to stop having meat to work in your mouth, really.
Yeah. I used to love those disclosing tablets when I was younger. I thought they were brilliant, but they turned everything like bright purple, and my mum hated them, but I thought they were brilliant.
I do that, but the funny thing is now that they even show you how old the plaque is. So you can see certain colours are, I forget if it's red or blue. The fresh stuff that's during the day is blue, and the older stuff is red. So you can see if your children are constantly missing. However, the big tip with your bathroom is fill the sink with water because the last thing you sit there and think, there's spat into the sink and there's a purple blob in the middle of it. And you'll come back to it in the morning and think, great, not just toothpaste, purple. Yeah, bleach comes out. So the real big tip is to fill your basin with water before they do it. And I love it because the kids, they'll come down and they'll say, "Oh, brush my teeth, Daddy." And you'll sit there and think, have you really got there? And the toothbrush is dry. You sit there and think, really? Or the next time, and then you catch them running the toothbrush under the water, putting it back in the, and you sit there and think, they learn, children learn, but with disclosing subjects, they can't. And they're a fabulous cheat tool for parenting.
Yeah, can't hide from that. If your whole mouth turns purple, you're not cleaning your teeth properly.
Absolutely, yeah. You're brushing it 3 times a day, not twice. But our job as parents is to manage our children. And quite frankly, lie to them quite regularly, but they haven't caught on with that yet.
I just want to circle back a little bit because you mentioned things like the air flossers and so like Waterpick. I know the foundation, we accredit Waterpick. It's a really good way to clean in between your teeth. But I want to touch on this idea of like premium products. And do you have to buy the expensive products to be able to take care of your mouth? Or can you get away with using the cheaper alternatives?
It depends which level of cheaper alternatives. So between you and me and the audience, Philips do a range of Sonicare toothbrushes, and the insides of those brushes, it's the same technology all the way through, from the bottom end right up to the top. However, they add in different functions as you go up the line. So some will, the top end will link into iPads and shoot 'em up games and that sort of stuff. But for me, it's about are you using an electric toothbrush? So is it one that is chargeable or is it a battery powered one? Personally, I think the battery powered ones are really good for getting your children using electric toothbrushes. It's a learning thing. It's not covering the bathroom, but once you've got the electric toothbrush, it makes a massive difference. So no, it's learning what is correct for you. It's going to your dentist and say which is the best product for me, because they're experts. To be fair, I'd go to my hygienist because they're so much better at knowing what's going on the market than me. But realistically, you don't need to go for the top of the range. However, the top of the range, they do come with functionality. They come with different things. A big top tip for using electric toothbrush, the heads. The heads are brilliant. Also, the little heads, they come, no one reads the instructions ever, but they come with little rubber rings or something on the top of them, so they're different colors. So therefore, you only need one base unit, you only need one handle, so you can replace the head. Unlike my house, where there's 6 different toothbrushes, because my children are filthy and I wouldn't touch what they use anyway. But when it comes down to it, you can get what's best for you. So some of the apps online, you don't even need to buy the products. You can just use a manual toothbrush and the shoot 'em up game. Kids get the iPad in the bathroom, and there's like, you get timing for 2 minutes, and you get points and shoot 'em up games and stuff, and they're really good. So you don't need to go really expensive, but often people want the shiniest, best things. So it's in the eye of the beholder. Work with your dentist, learn to use it properly, spend that time brushing your teeth for at least 2 minutes, whether it's electric toothbrush, manual toothbrush, and see where you're missing. And you can get, toothpaste is another one. There's massive ranges in costs. For me, the key thing is the active ingredients, the fluoride. So you look on the back of the pack and it says 1450 ppm, parts per million, and that's an adult toothpaste. So if you're an adult, you should be using that. So you can go to a major supermarket's own brand and look on the back, and it can be £1 rather than £5. But it's often down to taste. There's lots of different tastes. Some of the manufacturers bring some amazing flavor for the children's teeth, because children are hyper tasters, and you've got to watch out for my little girl. She gets the right concentration of toothpaste, but it's a strawberry flavored, and she won't have anything else. But when it comes down to it, she's getting the fluoride, it's working her teeth, not so much bothered by the mint. Off she goes, because often it's like we talked about chewing gum before. Chewing gum's far too strong for her. So we get the strawberry chewing gum, which is the sugar-free chewing gum, obviously. And we'll have that in our car when we get out. So it's a clearance after the day at school, eating rubbish that the school feeds them. It makes a massive difference. I think it's, as a society, we don't have an ability to take a step back sometimes. We just don't have the time. But by taking back step back the time, you can save yourself so much time with not having fillings, with doing the preventative journey correctly, and actually make it some family time if you can in the bathroom. We do. It's almost a game sometimes. My children, they'll brush their teeth. Children don't understand 2 minutes. So I say 6 seconds per tooth. That adds up to 2 minutes. So but for them, it's, you hear them counting in the bathroom, which is really hilarious.
I'm going to give a little cheeky plug to something as well, which is great, like a free way to make sure you're brushing your teeth for as long as you need to. Brush DJ, have you heard of those?
But the guy Ben who's made that is an absolute genius. It's brilliant for your phone, and it's a downloadable thing. It's made such a difference to people's teeth. He's brilliant. And there's also there's a Hey Dougie oral health brushing your teeth one, so for your kids to look at. So that's quite a good one as well.
So with toothpaste, like, I don't know if this is a fair comparison, but in my head, I'm like, oh, it's like paracetamol. If I can go into the supermarket and get a pack of paracetamol for 40 pence, and it's not branded, it's very, very, no frills paracetamol, or I can get a branded version for a few quid, it's the same dosage. So to me, that it sounds like the same sort of thing with the toothpaste and the fluorides. Like, if as long as it's got the right dosage on, you can get away with it. Is that a fair comparison, or have I missed?
I think for the broad strokes, yes, but there are some more advanced toothpaste coming out which have got enamel rebuilding parts in. It's the taste, and it does go back to that taste factor, because the concentration on the back is really important, and understanding. If you go onto our website, onto the Oral Health Foundation website, it talks about all the different what age that parts per million fluoride in, and that's the critical thing. Getting your teeth, the main thing is getting your kids to brush your teeth for twice a day for 2 minutes, and with a fluoride toothpaste, and make sure it's the correct concentration for the correct age group. But after that, you're looking at factors that it's down to taste, literally. Oh, I like the taste of that. That I feel better. I feel that works with me. There are some other building blocks in there, like there's a chemical called triclosan, which is an antibacterial agent. There are other chemicals they do put in them, but the really important one, the groundbreaking thing, is the fluoride. You're quite right. So it's exactly the same as that with paracetamol, but other paracetamols, they do have caffeine in them. They do have decongestants in. So it's what works for you, and whatever works for you, as long as it's got that fluoride content in, I will totally agree with. So
that's good to know. I think I've asked you everything that I wanted to know, especially about in terms of how a good routine and the regular visits over the long term, it can actually help keep your costs down, and you're less likely to, say if you're an NHS patient, you're less likely to have to go and get like a band 3 treatment and spend loads of money in one go. And is there any other like little pieces of advice that you think would be useful to give in terms of looking after your teeth, but also looking after your wallet at the same time?
Absolutely. The key one I used to tell my patients is going above and beyond for cleans for their teeth. Often patients want that white smile, so I'd often get all the stains removed first and say, is that enough, before you start going down the whitening route or the veneers route. And often patients go, do you know what, that's one of the cheapest things we do, even if it's private. It's actually looking for that aesthetical side and thinking patients are more conscious of their teeth, but they don't need to go really in depth with anything exciting these days. They can just look at it and think, do you know what, I'll just get the stains removed. Yeah, I'm happy with that. Brilliant. Talk to your dental practices and say, what can I do for preventative treatment? If you're a high needs patient, you've got a high decay rate, there's often stronger fluoride toothpaste. So it's all about prevention, Sophie.
100%, I agree with you. And well, Ben, yeah, it's been fantastic to talk to you. Where can people find you on social media if they want to look you up?
They don't want to do that. Instagram's @DentalBen, and Ben Atkins in Twitter, Facebook, the usual malarkey. But the main thing is the Oral Health Foundation website. So there's loads of top tips, and if you want to be involved in Smile Month, there's some amazing media stuff for your Instagram, your pictures, your downloads, and all that sort of stuff that the team have done. I think you've actually done this, haven't you, Sophie?
That's my handiwork. That's
there it. So, but I think there's a load of really good information, and if you're a parent wants to do some almost lessons on teeth at home, steal the Tooth Buddy stuff on the website. That's a really good tool. I'll be using that tomorrow when I go to my children's school to be a dentist in the classroom.
Oh, nice. Yeah. Dental Buddy's a great shout as well, especially if we're talking about prevention. Teaching kids early, it's fantastic. We love Dental Buddy. They're brilliant. Well, thank you, Ben. It's been lovely to chat as always.
Whatever. I'll catch you soon.
that was Dr. Ben Atkins. I hope you enjoyed our conversation as much as I did. It's always a pleasure to talk to Ben. Now, if you want to learn more about Smile Month, you can follow us on Twitter at Smile Month. Just search National Smile Month on Facebook, and you can also follow at Oral Health Foundation on Instagram. If you're listening to this podcast as it goes out, then you've got 1 day left to enter our giveaway. If you want some more bespoke oral health advice, you can contact our helpline at any time, and their information is in the description of this podcast. Thank you again, Ben, for joining me, and thank you to you for listening.